The best way to treat insomnia is to go to sleep disorders clinician who has specific training in treating insomnia. It does require a specific skill set and some specific training. Usually these are psychologists or mental health social workers, but not always. Nurses can be trained to do it, and others can as well. But I think then going to somebody, either most of the sleep disorders center within Melbourne have somebody who's trained to do CBTI, and then there are also a number of people in private practice who are trained and certified to do CBT for insomnia. So getting some short-term help from one of those folks can be really good. The nice thing about CBT for insomnia is that for many cases, many individuals, it only takes 6 to 8 weeks before to complete the entire treatment. And some people can actually do it with only, say, 4 visits to the psychologist, and then they have the knowledge and they have the skills to continue the treatment on their own at home. So it is a relatively short-term treatment option.
So I would encourage people to talk to their GP about accessing some of these services, sleep psychologists or specific sleep centres. But it is fair to say that cognitive behavioural therapy as a strategy is quite limited as a resource, and it is a problem at the moment for patients to access skilled practitioners of CBT. Pleasingly, there are a number of sleep psychologists that are emerging in their numbers. The accessibility to these services is increasing. However, it is increasing slowly, and there are web tools that are available, and in fact some people can access CBT as an online tool, and you can Google those.
The CBTI Coach, it's a freely available app that takes you through the whole thing if you can't get in to see a counsellor, if you're in a rural area for instance, because it is a very specialised field. It actually, it's developed in America by specialists, and it teaches you all about sleep hygiene. It gives you sleep prescriptions. It has a sleep diary included. It does a whole lot of stuff for you, and it's a really good substitute if you're not able to get in to see someone.